Eye on Health, brought to you by Tallahassee Memorial Healthcare.
When pain strikes, Tallahassee Memorial Healthcare's board-certified foot and ankle surgeons are here to get you back on your feet. Today we're going to talk about the total ankle replacement with Dr. Aaron Geyer. Thanks for being here today, Dr. Geyer. Why would a person need a total ankle replacement?
People that need an ankle replacement are those that have arthritis, usually over age 50, and have tried a lot of other treatments that we do for ankle arthritis, such as braces, injections, and medications, but they're still having pain and it's restricting them from doing the things they want to do in life.
How is the surgery different from, say, a knee replacement or a hip replacement?
Well, the implants we use are very similar. However, the surgery for an ankle replacement is a little more complicated because of the area we're doing this in. It is a longer recovery for an ankle replacement as opposed to a knee or hip replacement, just because we have to protect that area a little bit longer before people can walk on it.
What's a typical recovery time look like?
Usually by about 10 weeks after the surgery, people are back in regular shoes, doing pretty much everything they want to do. However, the first 6 weeks does require people to be on crutches or off of their feet, not putting weight on that area.
And how successful is this kind of surgery?
This is a very successful surgery. My patients that have had ankle replacements tend to be some of the happiest patients I have, basically because the pain they had beforehand is gone and they're able to get back to walking and activities that they weren't able to do before.
And it's great when your feet don't hurt.
Exactly.
Okay, Dr. Geyer, thank you so much.
Thank you.
To learn more about total ankle replacement surgery at Tallahassee Memorial Healthcare, please visit tmh.org/ortho.
Eye on Health, brought to you by Tallahassee Memorial Healthcare. Your hospital for life.